All right. So Sarah is, well, it's going to be a little bit different. Sarah had a really cool icebreaker planned for us. We can do our best with what we have. Sarah, do you want to come around and take my seat? Can you walk around?
Yeah. Hi. So the icebreaker that we're going to do, it's called I'm included, you're included. And the way it works is somebody's gonna say, I'm included, you're included. And whoever identifies with the statement, they're gonna move or
Virtually.
yeah, virtually move. And then whoever's left in the middle, they'll do it again. I'm included, you're included if, and then a statement about themselves, and whoever agrees with it, they'll move. So I don't know if we want to move in person.
Probably we can't move in person because we have the virtual
That's
people
true.
also. But we can just
Yeah.
we can do
raise
raise
your
we can do
hands.
raise of hands. So we can start and then you guys can jump in.
So I'll go first. I'm included, you're included if you identify as a woman.
I'm included, we're included if you identify as Black or person of color. And their hands, unfortunately, I can't turn it because the cable is so tight. Sorry. Okay, so we have hands. Would you like to try?
I'm included, you're included, and I'm not a native English speaker.
He said, not a native English speaker. Great. Would you like to try?
I'm included, traveled about at least a few hundred kilometers to reach.
If we've traveled, if you didn't hear, there's a microphone. Sorry. If you've traveled a few kilometers to get here. So it would be everybody who's physical.
Here.
Yeah, everybody's included. Or you want to give somebody online an opportunity?
Yeah. If one of y'all want to go, you guys are more than welcome to unmute and take turn.
I can go. What is the sentence? I'm included, you're included.
Yep.
If you're a first generation immigrant.
That's a good one. Oh wow, that's a good one. Want to give one more?
Yeah. I'm included, you're included if you've ever used any type of VR device.
That's a good one. VR. I see. Never?
You never use it?
I tried, but I am not using it.
But that's good.
I tried and decided not to use.
You tried and decided not to use. Why?
I didn't feel it user friendly enough.
Do you happen to know which one you use?
I tried the Oculus.
And you didn't like it?
Okay. Interesting.
Okay.
All right. So, do I have to get your email, right?
It's in my email.
Yeah.
Oh, it's in my email. Can you talk from your head? Do I have to open my email?
Yeah. Okay,
She sent me her presentation because we have the one computer. So sadly, I can't switch out to switch hers onto it. So if you give me a minute, while I'll open it for her.
I have a random observation. Your both glasses are very
clear.
similar.
I'm included, you're included. We have the same glasses.
You should say that.
That's a good one. Okay. All right, there you go. That's yours.
Okay, thank you. So keeping the activity in mind, how can we make everybody feel included in a digital space? So this idea is what actually inspired 3 traditionally marginalized students with diverse backgrounds in business and veterinary medicine who would not be in this space if not for this project to come together to create a virtual reality photo narrative tour about places on Penn State Abington's campus, which happens to be the most diverse campus, where they felt included. So this is where the hashtag "We Are Included" came to be. So if you don't know anything about Penn State's motto, our motto is "We Are." So we're gonna try it today. So what?
So hopefully, Pierce, you know the chant too, because you're a Penn State.
So when I say "we are," y'all are gonna say Penn State, and when I say "thank you," you're gonna say "you're welcome." Okay? Everybody ready?
Ready.
We are.
Penn State.
We are.
Penn State.
Thank you.
You're welcome.
So the model represents the idea that no matter who you are or where you're from, you have a place at Penn State. You are included. So as we transition into Web 3.0, STEM-focused people sometimes tend to forget that people are not always STEM, and technologists sometimes forget that STEM people are not always technologists. Non-technologists and everyday people may not be able to interact with technology in a meaningful way. So a prime example would be me. I am a vet med major. I'm only in this space because of my undergraduate research in the digital divide, as well as this project, which uses 360 photos to tell a story. For other members of the non-STEM community, like my co-researchers who are sadly not here, they are both business majors and they would not be in this space if it wasn't, again, for the research. So if non-technologists are not experiencing this technology, we're in a way creating more digitally marginalized communities. So when y'all get the chance, I invite you to go on the conference website, find the Digital Diversity Co-Located Workshop, and then on there you can see the 360 project that we put together.
And just because of time, at the end, I'll show you exactly how to find it. But if you do go onto the IEEE website right now and then find the workshop, the link to the workshop, she uploaded her their group's VR video there, or tour there, which you can view in the Oculus or on a regular phone. All right, so let me go back for a quick minute. All right. So one of the reasons why we decided to have this talk is because I participated in what some universities call COIL. At our university, we call it EDGE. It's a collaborative online internet learning between universities where students get to collaborate on a joint program. And throughout that collaboration, they work on any activity of your choice, right? And ideally, it's meant for cultural exchange. It's meant for you to work across boundaries, all of that. The most interesting thing that came out of it for many of my students was they never knew what WhatsApp was. They started out communicating with people through iMessages. And it was interesting that when at the end of it, I asked, how was the collaboration? How did it go with your partners? And they said, we couldn't reach them for weeks. And it wasn't until long after we recognized that nobody had an iPhone. And so nobody was getting the messages. So that was one of the first conversation that we started to have about what it might mean to collaborate across different forms of technology. And then, of course, now what does it mean for us to diversify the way in which we communicate with each other or collaborate with each other using these technologies. I am going to hand over to Dr. Jagannath to talk to us a little bit about what that might look like in healthcare space.
All right, thank you. Let me start sharing my screen. Okay, what do you see?
Yes, we're seeing it.
Okay, perfect. All right, thank you, everybody. Good afternoon. Just as a quick intro, I am Swati. I am currently a user experience researcher at Microsoft. Like Kim introduced, I did my PhD in human-computer interaction at Drexel University in Philadelphia. although I'm not working on healthcare technology right now, for my doctoral dissertation, I looked at the technology used among clinicians, specifically in trauma resuscitations, which is a very time-critical and safety-critical setting, even within general healthcare settings. So I would like to highlight here some of the digital diversity and equity in healthcare settings from the lens of my prior work in this domain. I understand the focus of this workshop is on Web 3.0 technologies like augmented and virtual reality. However, I don't want to start directly with AR/VR. Let's get there once we discuss a little bit about the basic access to healthcare systems and how they differ in both developing and developed countries. Little story, like I mentioned earlier, my dissertation research was in healthcare, and all of the research I did was in the United States, which is a developed country. I conducted field studies, I did observations here, and I am originally from India, which is a developing country and also the largest country by population right now. So both of these aspects, the developing and population, they bring their own set of challenges for healthcare access. And I often found myself thinking a lot of the research that I did during my PhD was not directly or was not like super applicable to my country or any other country with a similar infrastructure. So let's begin by getting an overall idea of what digital divide is. I think you might have already been thinking about this, or a lot of the people on this panel are experts, but also it represents, in healthcare settings, it represents a critical challenge in modern healthcare systems. While there is some digitization that is happening in healthcare, and that has offered immense potential for improved patient care, streamlined administrative processes, not everyone has equal access to these benefits. And I want to highlight some of the aspects where we see digital divide in these like comparison of developing and developed countries. Let's go through that very quickly. Let's think about any developing country with limited or still work in progress infrastructure. Let's take a step back and think about how those countries handle the healthcare in those settings. Some of the things where we see digital divide is in the first and foremost access to electronic health records, which seems like very basic here in the US, but also it is a very fundamental component of modern healthcare. But in developing countries, hospitals very frequently do not have the infrastructure set up for EHRs, which then results in difficulties in information exchanges or sharing patient information across institutions. And from a patient perspective, the patients miss out on the benefits of streamlined and coordinated care. They go to one hospital, they don't have the information. They go to another hospital, they don't have that information. And also overall, patients who lack access to the internet or electronic devices, they may struggle to view and manage their health records online. Like what we do here, we can see our appointments online, we can manage all those, but patients who do not have access, they cannot do that. And on a related note, if we think about it, access to digital prescriptions and medication management are also unavailable for these group of individuals. And research has shown that those access to those apps, they help with improving medication adherence, which has a trickle effect of, okay, we don't have access to this, and now we are losing on the compliance and those kind of things. And in addition, people who do not have access to other health apps also lack the general knowledge about like health monitoring and self-help access and those kind of things. And continuing that discussion about the digital literacy, individuals with limited digital literacy skills often struggle to navigate the use of healthcare systems effectively, and this can also hinder their ability to access the healthcare information and services. And the fourth point that I wanted to make was the importance of telemedicine. And, we are all virtual right now, and COVID-19 pandemic highlighted the importance of telemedicine, but also it emphasized the disparities in access to this service. Again, like without reliable connections, appropriate devices, individuals could not go to these appointments or get these care. And last category, I combined this big category into one. This divide not only affects patients, but also impacts healthcare providers. Let's think about it, particularly in resource-constrained settings, like what we are talking about, like in developing countries, right? They may struggle to implement healthcare technology for patient care. Let's say from a provider's perspective, the use of clinical decision support systems, which was the basis of my dissertation research, I can think about it that I don't know like when that will be implemented in my country, right? And then disparities in access to healthcare technology can affect largely the research and population health management efforts, because they do not have the data, or the data is skewed. And if the data is not representative of these underrepresented groups due to the digital divide, that will then lead to biased conclusions and potentially inadequate interventions. So it's all a trickle down effect from one to the next. It just like keeps on going. And now that we briefly discussed about the disparities in healthcare, in technology access and basic healthcare systems, let's think about the challenges with adoption of AR, VR, and how these challenges may be reflected in those. And Kim, let me know how I'm doing on time. This is my last one.
Okay, sure. You're good.
Okay, sounds good. All right, first let's think about developed countries. I heard one of the people there they just already talked about, oh, I did not like the AR VR because I did not, it was not easy to use. But think about that in a healthcare setting. Like you ask them to wear like this big goggle or something and perform surgery, the user acceptance is so low. And there is like a big body of literature on this. I'll get there, but there are other things as well. The cost of implementation, and they require specialized hardware and software, and the cost and availability of such hardware is so high, and that plays a significant factor in adoption. And then the second one is, in developed countries, let's take an example, United States, the healthcare is subject to stringent regulations such as HIPAA, right? And ensuring compliance with these regulations when using the AR, VR technology is very important, but is also very challenging about like how do this technology handle the security and privacy of like patient data. And again, like we were just talking about, first of all, there is a learning curve. It is technically challenging to set up and maintain these technologies. And even a minor technical issue can disrupt the healthcare workflows and affect patient care, and can also lead to, sometimes poor patient outcomes. And if it's not working right, and immediately that will lead to poor adoption and poor user acceptance. And healthcare professionals, they are, even with like electronic health records, there was like so much reluctant to change. They would just, in my research, I had observed that they don't want to write on the electronic health record. Like they'll just they'll just turn it off, start writing on paper. So it just, it just very, very quickly, they try to figure out workarounds. So I think that user acceptance and adoption rate becomes like just drops with the learning curve. And last but not the least, lack of industry-wide standards, which is still being developed, I understand, for AR and VR technologies, that can impede to adoption, because standardization is important for compatibility and scalability. Because again, like we were talking about, if you think about EHR, it is being widely used because of the information exchange and because of the standardized forms, and that is helping with the scalability. And also another challenge is integrating these technologies with the existing systems, which are complex and legacy systems in healthcare. As you might be aware, that is often challenging. And now let's think about these kind of challenges, but in the lens of developing countries, right? So how would that happen? These still exist, but maybe in a little different kind of a situation. So developing countries also lack the the cost is still high, but they also lack the necessary IT infrastructure, reliable high-speed internet, power supply, which is essential for all of these systems to be used effectively. And again, like I said, cost is high, and that problem still stands. The second point is about the compliance with data privacy. So there are not a lot of stringent regulations in developing countries. At least in my background from India, I don't know how much strict regulations around HIPAA and those kind of things there are, but that is a different kind of challenge, as they may not have the well-defined regulatory frameworks to adapt to these technologies. And then again, still costly to implement and maintain, even for developed countries. And then the last point is the content and applications for AR, VR may not be readily available in local languages and may not address region-specific healthcare needs, which is because it's still not standardized, it's still not, the content is still being built. So the point that I was trying to make here was that while AR and VR can improve access to healthcare services, these technologies may inadvertently exacerbate some of the disparities we already have in healthcare access. And only with access to the patients or providers with access to those hardware and infrastructure may benefit, and potentially leaving those marginalized who cannot, those groups behind. But that's not what I wanted to take away. That's not what I want you to take away from this talk. I did want to highlight some of the challenges, because these are some of the considerations that people who are designing, developing, and implementing these technologies should keep in mind. So with that in mind, AR and VR could still be promising in healthcare, as they provide enhanced medical training, improve patient education, reduced risks, and then also training in risks. There is already a lot of AR, VR technologies in training in surgery and those kind of things, and also enhanced therapy options. And in developing countries, in addition to all of these, it could still help in addressing a shortage of medical personnel, which is a big problem in developing countries, like the telemedicine and those kind of things, and then also enable telemedicine services. So additionally, I would say that international collaboration and knowledge sharing can help leverage these expertise from a little bit more technologically advanced countries, so that they can also they can support the innovation and research in developing countries. So I would want to stop there, and I know there are other presenters on this topic, and I would like to take questions probably after that. But thank you for your time.
All right, thank you. I wanted to open up with you guys. Do you have a question for her or comment on what it is that she has presented on? I think she made some some of the things that you pointed out specifically. I especially someone coming from a developing country myself, I'm from Jamaica. A lot of these things resonate with us because electronic health records are
non-existent.
I want to say non-existent. We are trying. We are digitizing, but I don't think we are at the point of electronic health records where the systems are collaborating with each other, right? And a big part of it is what you said, not wanting to change, even things as simple as the electricity, or panelists from Jamaica might talk some more about that. We have constant outages, like what might that really look like in terms of having electronic health records. So I want to open it up to anyone in the panel. If you would like to add a comment, now is a great time to do so before we move on. Does anyone want to add anything?
So I have a lot to say, but I guess I'll wait when I'm talking, I would address some
No,
of
please
them.
jump in. It's meant to be conversational. So if you would like to add, go ahead.
So I mean, I think that was a great presentation. I think I'm originally from Nigeria, and again, I can relate to it. We don't have like constant power, and we don't have the concept of EHR does not exist and stuff. But I think that was a great presentation. I think the other point I want to talk about is I'll wait and chat about it when I'm giving my talk.
Okay.
Yeah, because I'm going to talk about that. Yeah.
Okay. All right.
I think it's a good compliment then.
Yeah.
May I?
Sure, please go ahead.
Thanks for a good presentation. I connect with the whole issue of electronic medical record, electronic patient record. And, you know, whilst we have had initiatives in our local healthcare scenarios, and it hasn't really taken off so much in the public health sector. There are initiatives, but, you know, we haven't been very successful at it. I was more fascinated by the talk about the access to certain capabilities, especially with the use of, for certain therapies, access to VR, AR for use in medicine, for application of certain types of therapies. And one of the challenges we find is that people are excluded from accessing certain therapies because we don't have the capacity here. And oftentimes, you know, unfortunately, people either are unable to benefit from those, or will have to find exorbitant amounts to go and access it. And therefore, it raises an issue of exclusion because those things are not provided for within our local domain. So, yeah.
All right, thank you for that. Would you like to add anything to the conversation before I pass it to the next presenter? Not at the moment. Okay. All right. So we'll keep moving on. Thank you, Dr. Jagannath. I do understand she may have to jump off and jump back on, but I'm gonna pass it on to Dr. El-Memouni, who will continue the conversation for us. The floor is yours.
Hi, do you see my screen? Okay, so hi everyone, my name is Huda El-Memouni, and I am a CRA Computing Innovation Fellow, CI Computing Innovation Fellow, and postdoc at Indiana University Bloomington. I study telepresence robots in the context of the classroom, and today I'm excited to talk about the impactful role of robotic telepresence in education with a focus on inclusion and implications for digital diversity and equity. So in recent times, we've witnessed numerous challenges hindering physical presence in educational settings, from illness and disability to recent surge in COVID cases. And while most of us just realized the importance of presence, of remote presence with COVID-19, this is not new for students with disabilities. So repetitive students' absence leads to risking academic progress and fostering feelings of isolation, which research shows can significantly affect mental health and educational outcomes. Traditional online methods like video conferencing have tried to bridge this gap, but often fall short in replicating the rich social interactions of a classroom settings, because, you know, students cannot move around, they're just frozen indoors in their screens, and they, you know, can't interact with their, school environment. So robotic telepresence, and this brings me to robotic telepresence here. So it's a, you know, it seems like a simple technology, just like a tablet on a stick with wheels, but it does wonders. It's a technology that goes beyond standard video conferencing, providing rich, you know, rich communicative cues through facial expressions, voice nuances, and the ability to move in space. So while this technology presents a unique opportunity to enhance remote participation, it is not without challenges. Users must overcome, you know, the learning curve in navigating these robots and understanding their proxied body language, and while presenting themselves through a standardized robotic interface, which sounds like a complex process. Extensive research has explored the use of robotic telepresence across various fields, from offices to healthcare settings, but in educational contexts, particularly K-12 and higher education, the focus has largely been on user experience, interaction quality, and design implications. However, little is known about what mediates inclusion when we are using telepresence robots in the classroom context. So we conducted studies using these telepresence robots. We used ethnographic approaches to observe and document how telepresence robots were used in the classroom settings. We recruited 22 students to use telepresence robots to attend classes at Indiana University. We interviewed these students and 11 of their classmates and adopted an inductive approach to analyzing the data. So this approach allowed us to derive participant-centric definition of inclusion and identify its key manifestations in the context of telepresence. So our aim is to go beyond highlighting usability issues, providing best practices for leveraging this mature technology to support inclusive education. So I have here, I'll be highlighting a few of the findings here while we explore the, the landscape of inclusion mediators. We have discerned two overarching categories, technological aspects and socio-pedagogical dynamics. I will examine here these into a little bit more details. So I'll talk first about technological aspects. So in their core, these robots are game changers, acting as a bridge that allows remote students to participate and feel included in a physical, in a physical classroom. Their standout affordances and capabilities include real-time video and audio, mobility, and interactivity, bring in a tangible and interactive presence to remote learners. However, it's not a smooth sailing because there are technological barriers we cannot ignore. For example, glitches, latency, and design constraints that sometimes disrupt learning and diminish the presence of the remote student. Driver feedback underscores these challenges, emphasizing issues with signaling presence, like students cannot raise their hands and say, like, I want to ask questions because these robots don't have hands. Also, classmates also observed these hurdles, mentioning concerns like volume control, as the remote attendees cannot gauge how loud they are, which triggered like issues around privacy. So while telepresence robots offer a significant leap forward, they come with their own set of challenges that affect the complete inclusion of remote students. But we also have, in addition to these technological aspects, we found socio-pedagogical dynamics that also mediate inclusion. So when we delve into social norms and expectations, we see remote students constantly adapting to prevailing classroom social norms, while their classmates actively contribute to shaping an inclusive environment. So understanding the necessity for equal interactions. An example here is like classmates trying to help the telepresence students get positioned in the classroom so that they can get the best view of the classroom, but also be able to participate in discussions with their teammates. Moving to learning engagement, remote learners face challenges in terms of group synergy, and they rely on the assistance of their teammates. In contrast, in-person students display an adaptive nature. An example here is when there is hands-on activities and the classmates do not do most of the practical part because the robot, again, doesn't have hands. So if they're working on something, it's the classmates who have to do the thing themselves, which means like the remote students cannot, do things themselves, and, doing the experience is learning. Lastly, pedagogical adjustments shed light on the evolving classroom environment. Remote students underscore the need for instructor adaptiveness, while their counterparts emphasize collective responsibility, ensuring a smoothly integrated learning environment for all. So the professor, by making those adjustments, makes the classroom more inclusive for the remote attendees. And unless the professor understands, the limitations of those technologies, it's difficult to make those adjustments. So while I talked about these, my main, the main thing that I want to talk about here is, that the beam telepresence technology, while facilitating unique opportunities for interaction and participation, it also introduces the potential for a significant digital divide. So as Swati mentioned, she did all her studies in the US, but she belongs to a country from the global south. Same thing applies to me. I did all the studies with telepresence robots in the US. But while I was running the study, we realized not all students could use the telepresence robots from home. So yeah, we allowed them to use telepresence robots from home, but not all of them could, because this technology necessitates specific requirements, such as high-speed internet access and state-of-the-art computer systems, which may not be readily available to all potential users. So as a result, we see a clear demarcation between those who can seamlessly use the beam technology and fully reap its benefits, and those who can't due to limitations in access to necessary resources and infrastructure. So this disparity also can lead to digital marginalization, bringing to the forefront critical questions about how we can ensure equitable access and participation for every individual, regardless of their socioeconomic status or geographical location. So we can also think of this as a micro image, because I use it in the US and I still observed like some students cannot have access, but this is just a micro image that probably can reflect and illustrate the macro situation where people in the global north have access to these technologies, while people in the south don't. So universities in the north, in the global north, have the budget to buy these telepresence robots to use them when classes are hybrid. They have the budget to, they have the adequate connectivity to make them work. They also, students have the adequate technology to operate these beams, like, in general. I know, like, even in the US, there are some people who don't have the technology. So, but in the South, in the global South, universities do not have such luxury, and so sick or disabled students will mostly be absent, further marginalized and isolated. So while in my work, I propose guidelines to improve inclusivity when telepresence robots are used in the global north, bridging the digital divide at the macro level, at the world level, remains out of scope for me, but something that I wish to pursue through research in the future. But I know, like, for example, because I am from Morocco, and I know that in Morocco during COVID-19, you don't have these MOOCs, and not in every institution, but students and their teachers and professors were using WhatsApp to communicate and learn, and and it doesn't sound like an efficient way of teaching and learning. So yeah, so if you have any questions, please ask me now or later. You can also feel free to contact me with my email. Thank you. I can hear you.
I'm muted. I'm sorry. I was saying thank you for the presentation. I know I was smiling ear to ear as I was listening, and I noticed that the participants who are here, again, they took their phones out and they were videoing. So I'm assuming that meant that they were also interested in seeing the robot in the classrooms. But I want to, open it up with, do you guys have questions for Dr. El Mamouni or comments? Yes, no, maybe so. Yes. All right, go ahead.
It should be interesting actually to know how the after effect of, especially after the pandemic, how the differences has been in the developed countries like the US and so on, as well as in the South, as she was mentioning. Because as far as me, I've been teaching in Oman, and the impact from my point of view, it's been at least among people within that has been really challenging to overcome this sudden absence of physical presence and so on. That gives real kind of an opportunity to know about that. The impact has been that the performance of the students has come down because of this kind of virtual presence, and even now also there is reluctance among people from those countries, because there's sometimes power outage, or sometimes they say the internet is slow or something and so on. That could be interesting to study about how's the impact of this robotic presence or telepresence for classrooms.
Were you able to get all of that, Dr. Emimuni?
Yeah, so part of the question I couldn't hear, so I could hear some details, but not the whole question. If you can just summarize it in just few.
Yes, he was giving his perspective of being from Oman, and commenting on the fact that he thought that, or thinks that it would be very interesting for us to further this discussion in terms of telepresence in the classroom, especially in places like you've mentioned outside of the United States, where sometimes electricity, something as simple as electricity can be a burden or a barrier for students to overcome. And of course, post-pandemic, what that looks like for our students, because as he's mentioned, post-pandemic or during the pandemic, we know that participation was lowered, but now post-pandemic, kind of wondering as we get back out into the classrooms, what the potential of these types of technologies how it might impact education going forward. I hope I summarized it. Yeah, okay. Would you like to comment on that?
Yeah, so when I'm talking, I'm just talking from my data. So I never use telepresence robots in Morocco or in a country that is not the US. But even in the US, we were not able to use telepresence robots during the pandemic because, and that's what, so I should tell you about this because this was my dissertation topic. And then when I was reading, I proposed my dissertation and everything, and had the robot, and then the pandemic hit. So I was not able to collect data for my dissertation because for these robots to work, they need a hybrid environment. Not everyone is online because they need other. So it's only one robot in the classroom with other students, our classmates who are attending in person. So it was not useful at all. So people were using Zoom. We cannot imagine, everyone going to class, like a class of 20 people, all robots, because, it's not really something that people would want to experience, especially with when the robots are talking, you cannot hear who said what. It's like talking through a computer. It's it doesn't work. But it's, for telepresence robot, students who I interviewed about their use of telepresence robots in the classroom mentioned that they feel more agency, when they are using the telepresence robots, because especially in a classroom where they have to work in groups and where there are activities, they need to switch groups and everything. It's better to be attending via telepresence robots because you can go around the classroom, join this team, and then join another team, approach the professor, move closer to the screen and everything. It's not the same as when you are just in Zoom. So yeah, I think that's what I wanted to say.
Okay, wonderful. Thank you for that. Is there anyone online that would like to comment before we move on? I want to give you the opportunity to do so. All right, no? Okay, so thank you again, Dr. El Mimouni. Oh, I'm sorry. Did anyone else here did you want to comment on anything before we move on? No? Okay, thanks again, Dr. El Mimouni, for that great presentation. We're gonna continue because of time. Not that we are strapped for time, we still have an hour and change, but I want to make sure that everybody gets an opportunity to contribute. What I'm going to do is I'm going to use the thumbs up in the thumbs up icon when it's time for you to take it home, so that we can leave enough time for everyone to make their contributions. So I'm going to move on now to Dr. Andy. Dr. Andy, the floor is yours whenever you're ready.
Thank you so much. So I don't have any slides, so we're just gonna chat. And I'll tell you what I've done and what, yeah. But let me start by introducing myself, and well, I guess I should say thank you for having me on this panel. So a little bit about myself. I am an ATMD. I'm a faculty here at Howard University. And I do like research in AI where we apply to health-related data, so electronic medical records data and data, like social media data and data from wearable devices related to health and well-being. And prior to this, I spent about 4.5 years at Penn Medicine, where we did a lot of work related to that. And so at Penn Medicine, I did work around predicting patients' risk for cardiovascular disease using electronic medical records data and data from social media. So we got like millions of Twitter data and Facebook data from patients who consented to share access to their social media data. And we use that data with their electronic medical records data to do various things such as predicting their risk for cardiovascular disease and opioid use disorder and so on. And then I've also used social media data to do a lot of work around loneliness, for example. So we started working on loneliness before COVID, and the interesting thing was that we tried to submit so many papers before COVID, and the feedback we got was that loneliness is not a thing, that you can't define loneliness. But once COVID hit, all our papers just started getting accepted because, like, everybody started talking about COVID. So, but we did a lot of work around COVID, and so some of the work we did looked at. So we looked at loneliness across age group and gender. And so we see that, for example, people in different age groups, so those between 18 and 22, and those say in their 30s or 40s, who express loneliness on social media seeking different types of support. And so when designing interventions, it's important to take into consideration these different factors, that it's not a one size fits all. I'm also working on a project now where we're looking at race and ethnicity as it relates to that. So the way to think about it is that in some cultures, people are raised to numb down their feelings and emotions that are not as expressive. And so when designing interventions around loneliness or another, whether it's substance use recovery or whatever, it's important to take into consideration the people's ethnicity and race when designing that, knowing that just because someone is not complaining about something doesn't mean they're not going through stuff, and maybe there are ways you could probe them to, like, figure out what they're going through, and then, like, provide adequate support. So that is some of what I'm doing. I know some people have talked about electronic medical records and the issues in, like, different countries. So when I was at Penn, in my role, I had access to, like, all the electronic medical, and University of Pennsylvania has, like, I don't know, 6, 7 hospitals. We had access to all those electronic medical records. And with that, we could make predictions and so on. But at Howard now, I'm now working on a project where, so at Howard, we have electronic medical records, but there's several of them. They're not integrated. And so now we're trying to integrate this electronic medical records. And we're starting now, and speed is going to be a challenge, but I think it'll be interesting. So the point here is that, it's not just happening in different countries outside the US. In the US, we're still struggling with, like, electronic medical records and making sure that we have all the data together to gain better insights. So as it relates to AR and VR, that's not, I don't do a lot of research in that space. I'm getting into it. But I think one of the things I've learned in my work with electronic medical records and social media data and so on is that when working on these tools, or like developing tools for predictions and so on, the design is important. It's important to take into consideration who your users are and what their experiences are and where they come from. And this would, help get traction and so on would help you doing that would help you design like these tools better so that these users can benefit more from these tools, as opposed to just building a tool and assuming that it works for everyone. And also the other way to think about it is that when designing these tools, it's important to get as many diverse opinions as possible. So, getting people from different backgrounds, working on the design and making sure the design is right before even starting implementation. And when you do the implementation, like just testing it out over time to make sure that it works for everyone. Yeah. But that's what I have. I'm not, I don't know if yeah. I don't know if anyone has any questions, and I can, if you want me to go deeper into like specific projects, I can do that. But I would take questions.
Okay. All right. Oh, sorry. I was just making sure I wasn't muted again. Thanks again, Dr. Andy, for that. Would anyone like to ask Dr. Andy any questions before anyone online would like to talk some more about what that might look like? I know for me, social media is an interesting one, especially when it comes on to, especially when it comes on to diverse peoples and their voices online. Have you noticed anything of interest as you've gone through, especially the loneliness data online? Have you noticed anything of interest that you are able and willing to share with us?
I can tell you so many interesting things. So we've shown that, for example, so people in their 40s, for example, who express loneliness, one of the topics they talk about is like pets, like like maybe spending time with their pets and so on. We've seen that so women are more expressive, like they can unpack their emotions and they're more expressive than say men who, rather than being expressive, they just use curse words or like talk about like drinking and stuff like that. We've also shown that so loneliness is comorbid with anxiety and depression, and so we separated, so we identified users who were lonely and depressed and those who were lonely and not depressed, and we see that the differences in the type of support they're seeking. So those who are lonely and not depressed, for example, one of the things they talk about is maybe they move to a new city and they don't know anyone, right? And so they're trying to figure out, where can I go or what can I do? And then those who are lonely and depressed are talking about like, maybe self-harm and stuff like that and so on. But the other thing too is that we have, at least in that study, we had data tied to like counties across the US. And so we could tell with relative accuracy what county people reside. And so one of the recommendations or one of the things that came up from the study was that if we know where people reside or have a sense of the vicinity or the county where they reside, we could figure out ways of advertising things. So one of them is like a gardening club. Some people are into gardening. So if you advertise that, maybe there's a group of people interested in gardening who are meeting up somewhere, you could go there and meet up, and then like, maybe that would help you form community and stuff like that.
But Dr. Andy, that depends heavily on your internet connection too. As the previous presenters mentioned, that heavily depends on your internet connection and your ability to use the technology effectively to reach those resources, right?
Yeah, that is true. So the other thing too is even the ethics of this, right? I think so that's the other thing. So we do all this analysis with social media and we get all these insights, but what can you do about it? So for example, if I identify that someone is lonely, right, you can't just reach out to the person and be like, oh, I know you're lonely now and I can provide support. That is an issue. So how do you even, that's still an open question. I don't know that there's anyone who has figured that out. And so it's one thing to get all these insights. The other thing is, what's the best way to approach these people, or should you approach them, or how do you go about that?
Fair. Okay, would anyone else like to chime in? I'm giving you the opportunity to before we move on. Do you like to comment? No, you're just listening in? Okay, that's fair. All right, would anyone else like to chime in? Otherwise, we will move on for the time being. All right. So we'll pass it off now to Dr. Ricardo Anderson. Thank you again, Dr. Andy. Dr. Anderson, you hear me?
Yes, thank
Okay.
you very much. Are you hearing me and hearing me
Yes,
very well?
yes, we can hear you.
Okay, all right. So thank you again. Hold on, I don't think you're seeing anything from me.
Not at the moment.
Not at the moment, I can imagine. All right. So while I bring that up, thanks everybody for having me. I'm Ricardo Anderson from the University of the West Indies, Department of Computing. And I'll be talking a little bit about digital diversity in education policy. And
still hearing me, right?
Yes, we are hearing you perfect.
And you should be seeing my screen now, right?
Yes, seeing it perfect too.
Right. So I want to talk a little bit about digital diversity and equity in education policy. And whilst I don't have a full presentation, I wanted to kind of keep you on topic by just showing you the screen here. So yeah, so first of all, I wanted to dispel for many people, they think most of the times it's limited to learning in front of a computer when we talk about digital diversity, but it really isn't. It has multiple facets. It includes using digital media, access to information about digital media. It also includes, oh, I thought my camera's on. That might be better. All right, there you go. All right, so we're talking about using digital media, about providing information about digital media, having access to digital media in spite of your circumstances, and also digital education that includes the use, sorry, not just the use, but via some digital media provisions. Now, unfortunately, what we find is that if in many cases this is not explicitly focused on in policy, it might end up that there is a lack of inclusiveness. All right. So inclusive education with digital media really means that you have to have inclusive content and inclusive devices. And one of our presenters mentioned devices, right? Inclusive education with digital media means, relatable and accessible resources in terms of content and software, accessible devices that are appropriate to different audiences. There's need to provide access for all, regardless of limiting factors and specific circumstances. And then, of course, making sure that those who have special needs and circumstances participate equally so that they can benefit from educational opportunities just like everybody else. So I took a quick look at, for example, developing versus developed. So I looked around the Caribbean a little bit to see what's available, like in Jamaica and in Trinidad. And whilst Jamaica has a strategic plan that includes some aspects of digital inclusiveness by a couple of the projects that they have embarked on recently, including putting devices in schools, libraries, in public spaces, so that people who may not have the resources on their own can actually benefit, right? Everybody's still hearing me, right?
Yes.
Right, can actually benefit. We don't see that in their education policy. It is explicitly taken care of. And that, whereas when you go, for example, and look at a country like Trinidad, they have an inclusive education policy that emphasizes equitable access, equitable resourcing, right? And they have spelled out the need for budgetary allocations to be made for public school on a per capita basis in terms of the allowance to make sure that there are explicit plans and programs for inclusion, especially of at-risk groups, in every aspect of their curricula, right? Attractive. Then took a look at, for example, I know there's a policy that that has been promulgated in the US generally at the federal level, but I kind of zoomed in into digital education policy for one school district. You know, I just picked New York, for example,
Of course.
and found that and found, of course, that they have programs in place. Of course, they have outlined 5 elements in relation to their digital education policy. Affordable, robust broadband internet services, internet-enabled devices that meet the needs of the user, access to digital fluency training, quality technical support, and applications and online content designed to enable and encourage self-sufficiency, participation, and collaboration. Coupled with that, they have moved even further to actually define some short, medium-term, and long-term goals. Of course, they want to ideally have statewide digital navigation training programs that will ensure that digital navigators would be centralized at public libraries and localized community-based organization and specialized expertise that could help community access specific resources that they require. And of course, in the long term, they want to establish state level presence that coordinate and pilot robust systems for digital inclusion partnerships amongst community groups and all the stakeholders so that this can be scalable. Of course, what we see is a variation between explicit policy and a kind of expectation that it will happen in an emergent way if you provide the resources. And just to summarize and put forward a view that what we will find is that in many cases, the state policies, the government or agencies have to intervene and put things in place because unfortunately, sometimes we move so quickly forward that we don't even realize that we're leaving some behind. And so, my contribution is that I think that the examples of NYC School District and Trinidad kind of suggest for us an important way that we might need to at least move forward, right? If policy is there, it actually provides a framework for guiding all the stakeholders and all those who are involved. And it also provides for those who might be excluded to have a say in their exclusion and be able to represent themselves in trying to ensure that those policies benefit them as they're there. Thank you.
Amazing. Thank you, Dr. Anderson, and thank you also for keeping to the time. I appreciate you. But that very last comment that you made, I think was a profound statement that sometimes we move so fast, right? We run ahead of the policy. But considering the technologies that we're talking about, Industry 4.0, Web 3.0 technologies like VR, AR, MR, and all the R's and so on. I mean, realistically, how quickly can our policies keep up with that technology? What do you think?
I think that it's important that policies are not necessarily required to predate the technology. But we can't run too far ahead without recognizing that there needs to be things in place to protect and to provide for everyone. Because inclusiveness is very, very important. And inclusion is not necessarily from the perspective of being able to access because you would like to. Sometimes it is so important, even with health and other areas, that it impacts your quality of life so much.
Yes. Absolutely.
Right? And so it becomes very, very important to make sure that we have frameworks in place. But I am not one who believes that policy needs to predate the technology. I'm one that believes that as we move forward, we need not forget about the policy. But education is such a public good that it needs specific attention because that's the engine from which all should be able to at least get exposure to. right? Whatever it is we're moving forward with.
I'm 100% with you on that. And I want to open it up for anyone else in our panel or comment, question, concerns,
Comment to all the speakers or
or if you would like to comment on this particular piece or overall or anything.
I have an overall question for all panelists.
Sure.
My question is like, you know, we had a good amount of discussions about the digital equity issues. So where does the solution lie? Is it in technology, or is it in policy, or is it like
Advocacy.
right?
Yeah,
So
that's true.
what are the panelists' thoughts on, you know, what's the right way to approach solving this problem?
All right, it's if you didn't hear, I'll just repeat. He's asking, where do we think the solution sits? Do we think it sits in policy? Do we think it's the technologists? Do we think it's a marriage of both or neither? Where do you think the solution sits?
Yeah, if I may, I think the solution sits in a joined up collaborative approach. I must admit, as a technologist, I am not so strong on the policy side of things, right? And so there are blind spots, and much of what I have been able to do in this area comes from collaborative work, right? And getting to understand, you know, what happens on the other side of technology. And so it's a joined up approach. I don't think our technologists may necessarily have the skill sets, right, to take it on. But I think we have to jointly recognize that whatever we do requires collaboration. And whilst we are busy moving ahead and driving technology changes and integration and innovations, we can have those who are keeping an eye out to make sure that this is being done equitable, right? Focus on helping us to ensure that we refine and we move ahead with it in the way that it's going to benefit and provide the kinds of public good that we need.
Yes, Dr. Elmimuni, I see your hand. Go ahead.
Yeah, I think it's a joint, it should be a joint collaboration between so many, stakeholders. It needs to be like tech makers, policy, and even education and, civil society. I think we need to educate. So we need to work on the technology. Policymakers need to make an effort into making like these technology, into like making laws and rules that would ensure that we take into account like, inclusion and diversity. But also, I think through education, we can sensitize, the future technologists and future policymakers about this. So, I think it's a collaborative effort between everyone, not only technology or policymakers.
Awesome, thank you. Anyone else, if you'd like to add before I take the next question? I see you, Dr. Jagannath, go ahead.
Yeah, just quickly, just wanted to reiterate, yeah, it is definitely a joint effort of all the stakeholders, right? For at least in healthcare settings, it is the hospitals also need to get involved, the government needs to get involved, it is the technology makers need to get involved. But I do want to highlight the aspect that it is challenging and time consuming. Just honestly speaking, I work in industry right now, and there is a big disconnect between academic literature and what the industry implements. So I'm not a solution maker. I don't know how to bridge that gap, but just wanted to bring that into discussion because at Microsoft, there is, even within Microsoft, there is a research group, and they do blue sky research. And a lot of the times for us to bring their research to our products takes so much effort and time because we are doing our own research separately. So just as an example, there are a lot of moving pieces. So, everybody needs to coordinate and collaborate. But I think having a discussion is the first step.
Awesome. And I think hopefully this is the first of many of those discussions. I think one of our speakers earlier mentioned about the economy of data, who is actually benefiting from it. And I think this is a great way to tie it back in for us to remember that the technology is being created. Yes, it is moving forward. We appreciate all of that, but then it does affect real people, right? In real and measurable ways. Before I get to your question, I think I had seen another hand here online. Was there someone else that wanted to comment? No, perhaps I was mistaken. Art, you have a question? Go ahead.
Yeah, the question I have is that with respect to recognizing persons and their disabilities, there are many things, especially when they are physically disabled, that we think about. Like, there are actually first-class principles that we think about when we're designing buildings. There needs to be ramps, there needs to be elevators as opposed to stairs, and there are so many things to assist with mobility around a physical building when buildings are being designed, and there are even laws that govern these things. Maybe that first-class approach needs to be applied to technology as well, with respect to not the creation of the technology, but how we assimilate it into different industries and spaces.
That's a great idea, and I'll repeat in case the persons online did not hear. The comment was that in our physical world, or policies or designs, everything is moderated by things like universal design, right? So we can see a person's physical disability, and so we accommodate for that. So if they require wheelchair accessibility, then we ensure that there are wheelchair ramps, for example, in the buildings. And so the comment is that perhaps as technologists, we need to start having that type of vision, that persons need to have access to our technology and need to be able to use it in the most efficient way for them, regardless of their abilities or otherwise. So I throw it back out in case anyone would like to comment on that.
That's a great point. We do have accessibility standards that a lot of the organizations start working on. There are standards for accessibility checks that there is a standard, but also organizations adapt their own checks. They do that, but I'm not sure if all the technologies, everybody does that standard, right? But, there is always, you have to provide captions and accessible telehealth platforms for individuals with hearing or visual impairments. And another thing also is along the same lines, there is also the aspect about language support. Like I was mentioning, that's not an accessibility situation, but it's still the non-English speakers, right? They cannot access the same kind of resources as English speakers. So I think those all come in the same realm of user-centered design and user-centered, human-centered design. So, and that definitely affects the adoption and acceptance of these technologies. But that's a great point.
Yeah. Okay, awesome. I am going to segue to Glenville and Howard to continue our conversation since they cover government and policy. Ideally, they're extending this concern that we are having with what it might mean to create more digitally diverse economies. All right, the floor is yours, gentlemen.
Hi, everybody. Kim, as you said, Dr. Hemmings-Jarrett, thank you for the invite again. I'm here with Mr. Reed. It's a good segue you have because the particular research that we did a couple of months ago looks at shaping government policy. And we did that in relation to marginalized students in tertiary education. So I'm just going to share my screen and please tell me if you can see it. All right, great. So good afternoon, everyone. My name is Glenville McLeod, and I'm here with my colleague, Mr. Howard Reed, and we're presenting on navigating the digital divide through community support and exploration of marginalized tertiary students in Jamaica during the 2019 COVID pandemic. Just before we begin, Mr. Reid wants to share just a bit in terms of what transpired that essentially shaped this inquiry of sorts.
All right, so pleasant good afternoon, everyone. So the first case of COVID in Jamaica occurred in around February, March 2020, and the University of the West Indies sort of jumped online, all right? So students had to transition from face-to-face classes to a virtual, so to speak, a virtual environment. So what we saw in the immediate aftermath was that the participation levels sort of declined. So we had classes with up to 60 students being registered or even up to 100. And students that were participating or logging in online, we saw numbers such as 20 and even 10, and in some cases, even 5 students. So we were wondering what was really happening with these students. Everyone has a smartphone, right? And at the same time, the government of Jamaica was, talking about robotics and AI and pushing Jamaica forward to harness the opportunities that would come with the fourth industrial revolution. Yet access to internet and devices suited for online education remained a challenge for many students. So this pretty much inspired us to conduct this research into a neighboring community where several of our students attend. They live in these communities, right? All right, so
during the 2019 COVID pandemic, the digital divide was often identified essentially as an obstacle to online teaching, and several inequalities in education were sometimes observed. And so in response to the pressing issue of this particular digital divide in online education, this research employs somewhat of a phenomenological approach through qualitative research design to investigate this particular issue. And the backdrop of the pandemic essentially magnified pre-existing disparities, marginalized student communities, which encountered several or significant hurdles rather in accessing education. And these challenges encompass a lack of essential resources and deficiencies largely in government intervention, which left numerous students struggling to access quality education. Now, utilizing the case study approach, this study explores essentially the lived experience of marginalized students as they grapple with the digital divide throughout the pandemic. And it thoroughly examines the profound impact of this divide on their educational journeys, offering somewhat insights into the nuanced dimensions of their particular struggles, their frustrations, and their coping mechanisms throughout this particular time. Furthermore, the research investigates how community support emerge as a pivotal force for bridging the digital gap. Things such as shared internet service, secure learning environments, which acted as a lifeline for a number of students when their home environments were less conducive to learning. And so framed within this phenomenological framework, this particular research advances the argument that community-driven initiatives play an indispensable role in alleviating the digital divide in online education. And so if we look at just briefly the methodology that was employed for this particular study, to gain a complex understanding of the impact of the digital divide on marginalized communities, exploratory case study offered a valuable avenue to investigate this particular matter in greater detail. These case studies meticulously uncovered the unique experiences of these communities, which shed some light on their struggles, the frustrations that I mentioned, and as well as the coping mechanisms. We deliberately chose the phenomenology as a qualitative research design, largely because it's inspired by its ability to explore the subject of experiences of individuals. So that's why we went ahead with this particular research design. And Howard can give some more insight into the collection or the data collection aspect of the research.
All right, so Glenville and I conducted semi-structured interviews with, well, we aimed for 50, but at the end of the day, we got 30 participants who belong to the community of Augustown, a neighboring community to the UWI. And these participants were intentionally selected through a random sampling process to ensure a diverse representation of the student population within the Augustown community. The interviews were carefully designed to foster open conversations about their personal experiences with online education. The questions that we posed aim to explore, the different facets of their experiences, including the difficulties they encountered, the strategies that they employed to overcome the challenges, and of course, a significant role that the community or community members played in alleviating some of the challenges that these students experienced when trying to continue their online education, or rather to continue their education online.
And so if we look essentially at the data analysis and the insights that were gained from this type of analysis, just briefly on the data analysis for this particular research, we collected data, of course, from interviews, and of course we would transcribe them and utilize open axial and selective coding mechanisms to essentially sift through the data. And key things that we found in terms of the themes that came out is that key in terms of what students highlighted is that community support would have been a major response, as they highlighted that communities, essentially members of the communities, came together and they relied on each other to access essential resources for online education, whether those be tablets or laptops or whatever the case may be, or in certain cases even cellular devices. But trust was a fundamental aspect for this type of support system. Additionally, shared resources is another key theme that came out, as trust and reliability are central to the theme of shared resources, whether it was internet access or borrowing computers or trust within the community. It played a key role in accessing online classes. Additionally, local Wi-Fi hubs were another feature. And this was highlighted as an integral mechanism or coping mechanism for a number of students, as there were a number of public Wi-Fi spots that would allow students to access classes, whether those are synchronous or asynchronous, whatever the case may be. And of course, adaptability and resilience, which is a major theme running across for a number of these students, given the nature of the pandemic and the uncertainty within that particular time. They highlighted that they leaned on each other, creating essentially dependable hubs for blended learning resources. And so what does that mean in totality as we look on the digital divide and marginalized students within a tertiary landscape?
So although the study primarily focused on an aspect of the third industrial revolution, the findings essentially bear significant implications for preparing these communities and the students alike for the fourth industrial revolution, where advanced technologies, as mentioned by the previous presenters, promise to sort of revolutionize their educational journey. Ultimately, our findings underline the critical role of community-driven solutions and the importance of trust, collaboration, and resource sharing in ensuring that the benefits of advanced technologies are accessible to all, regardless of their socioeconomic backgrounds. To end, our study emphasizes the need to nurture and support community-based initiatives as a cornerstone of equitable educational preparedness for the fourth industrial revolution in underprivileged communities where, access to certain devices and services are limited due to economic challenges that the residents and students alike face.
Just to point out in a more broader scale, this particular research that Howard and I took on a couple of months ago is essentially stage 1 of 3 that we plan to do, and all 3 stages will essentially look at various communities across Jamaica, but more or less the focus is essentially to look at how the information gathered through the research can essentially shape policies at the ministry level, and probably as well in terms of how it impacts on features relating to our legal discourse here in Jamaica. Given the fact that Jamaica is now going through several efforts at various levels to reorientate how education is delivered in its various facets. So that's the positioning in terms of a larger scale of this particular research. And this is just a snippet, so to speak, that we had to just trim down for the purposes of this workshop. But we appreciate the opportunity nonetheless just to share where we are in the process, and hopefully we can share a couple months from now better news if it ends up shaping major policies, which we hope it will.
Awesome. Thank you both, Glenville and Howard. Shameless plug. My undergraduate students from the University of Technology, just across the street from you guys, we did something similar, and we were published at ACM AMSIS. I'm sorry. Yes, we got published in AMSIS probably 2 years ago. So shameless plug. Google Scholar and find the work from those wonderful students. They actually found similar things that you found, where regardless of I think if I recall correctly, what they did, they looked at the tablets in school programs. So in Jamaica, there was at the time during COVID, similar to here in the US, where many students didn't have their own devices, right? And so there was a whole program that went on in Jamaica called Own Your Own Device, where the government were issuing devices to families at a particular socioeconomic bracket. But unfortunately, we found that they were not taking the tablets. And so it was interesting for us to try and find out why people weren't taking advantage of what we would have thought would have been a great opportunity to get a device in somebody's hand, right? And so what our students found at the time, there were many other reasons. So the device can be accessible to you, but there was a lot of miseducation about what the device was meant to do, the type of device. We found out that the brand of the device made a difference, and if it wasn't the particular brand, they were not taking it. There were issues surrounding the attachments for the device. I'm sorry, I'm hearing myself. Yeah, there's a issues surrounding the attachments for the device. So they did not. There were parents who came in not recognizing that getting a tablet meant you also had to get screen protector, meant you also had to get a case to protect it. And so when they were about to leave the store, and the store managers would say, well, would you like a screen protector, because you're giving it to kids, or a case because you're giving it to children, or would you like to purchase insurance because you're giving it to children? That cost, or headphones, because like you said, many of them lived in communities or bigger families where they would have several people making noise around them, and for you to participate in school meant you needed a headphone. That caused many parents to say, instead of saying, I can't afford the attachments, I'll just take the device, they decided not to take the device at all, since they could not get the attachments with it. So again, just shameless plug, go ahead and read their paper. I think it was a really good research that, and I think it would contribute well to the findings that you have here now.
Will do, because we found out several of those features when we were conducting the research as well, particularly where brand association is concerned. Some only wanted the Samsung ones, some never wanted the ones from Amazon and things of that nature. The Alcatels and the Huawei's and things of that nature. Brand recognition. Besides brand recognition was a key feature as well.
Brand recognition was key, but what our students found was that it's not just the brand, it is the social standing that the brand gave you, right?
Right.
Yes, I reckon if I have like you said, a Samsung, it didn't look as good in my neighborhood if I didn't have whatever the other brands were. So they opted out of having a device that would give them access to information and classwork and all of this, just because the brand did not give them a social standing. And so little things like this. I'm interested, when you guys move on now, as you talk about the implications for web, for Industry 4.0, what is that going to look like when we talk about VR and AR? When we talk about having immersive technologies, whatever that might look like. And for those who are here with us, we have a couple of the different versions of what that might look like how how people can afford an Oculus. And if you can't afford an Oculus, are you okay with a cardboard? Will you be okay with the cardboard, even though it will allow you access to the environment? And so I think it will be interesting when you expand or extend your research, because even Sarah, I mean, we were talking about it earlier. When Sarah started working on the project, Sarah never knew what virtual reality was, like the word. No. But you know, when I asked, and then as we spoke about it, she said, "Oh, my teacher brought a cardboard to my biology class one day." And I'll just show it since I have it with me. She said, "My teacher, we got it," and she said, "Oh yes. My bio teacher brought one of these to class one day." And so this is the cheaper version, right? And the teacher allowed you to watch what type of video?
It was a butterfly garden.
For what purpose?
It was, wow, we were doing plants and columns.
So it was just just science videos about butterfly gardens. And so they allowed the students to watch it on cardboard. What, $10 US? But how will those students that you're talking about, if we're trying to give them that new, how are they going to feel when we give them this versus when we give them this? And I see your face, like,
That's problems.
My answer to that would be like, whenever a new technology comes out, it's actually very pricey. When the very first smartphone came out, it was like not affordable for most population in the world. But today, almost every single individual in many places of the world own one.
In certain countries as well.
Also true.
Because even though Jamaica is there now, there's still an Android, because Android is affordable, and we have other classes of Android devices that you've never seen in the past.
So, but when these technologies were first introduced, I would say like 90% of people could afford neither an iPhone nor an Android phone. And what appeared to be like a very luxury product, it came out to be like more like a commodity product these days. So my feeling about these technologies is that as these technologies mature, you might be able to buy that for $10 instead of making the cardboard or I'm just joking. Maybe something more affordable.
I think it also has to do with how immersive the technology is. So if you put the Oculus headset on, it feels as though you're physically there, and it has the remote, so you can like see your hand, you can look down, you have an avatar. Whereas the cardboard, it's more like, you look around, you see the environment, but it's not as immersive as the Oculus, which is why the Oculus is more pricey. So while I do agree, as they come out with different models of the Oculus, like the older models are a little cheaper, but I do think that I agree with what you're saying. I just feel like it's going to take a very long time for us to get there. So if we're talking about exposing marginalized populations to this technology now, it's okay. How can we expose a bunch of people to one thing at one time? You know what I'm trying to say? So at that point, it would be smarter to do the Google Cardboard or the BNext compared to the Oculus.
So I'd like to add to that. So I would say it took about 20 years or 23 years to get where we are.
I don't know if it makes a difference. I'm sorry.
I can speak a little.
Oh yeah, talk a little longer for the person.
I would say it took about 20 to 23 years to get where we are with smartphone technologies today. Before we didn't have iPhones and Android. We started out with Nokia and Symbian, BlackBerry and Windows Mobile, and those are now dead platforms. Nobody has them. Nowhere in the Android iOS world. So, and what we're finding now as well is that we're moving from the hardware being expensive. The hardware probably is just as expensive for the manufacturer to produce, but the services that they sell on top of the hardware far outweigh them selling the hardware at that price point. So like Amazon today, they sell an equivalent, equivalently powerful tablet in terms of the Fire tablet to a Samsung, but they price it at $50 because they can get you on the services that they sell and the advertisements that they run through the platform. So there are other models in which they can use to fund it. And as more people, I think once the audience increases, then they can scale the subscription models, the software models, and the other models that will offset the cost of the hardware. But the audience isn't there yet.
Agreed. But you wanted to add something? Yes.
When the number of people increase, the prices might come down as well.
And I mean, that comes back to just economics, right? But I want us to really think about, as we are waiting for that to happen, while we are waiting for the Oculus to get to $10 or something more manageable, in the meantime, while we are promoting digital participation and equitable participation and inclusive participation, this is what that might look like, right? And how do we ensure that as we are preparing people for Industry 4.0, or probably whatever will come after that, right? Because we can't wait for this to get to $10 for us to start to prepare them. What does it look like now? And are we inadvertently, by either waiting for this to come down, or we feel so like what the previous presenter said, there is a demographic of people who they will never purchase something if they don't like the brand, or it doesn't give them a status, or there is that demographic of people. How do we ensure that we bring them into this economy? Because we are in a digital economy, we can't get away from that. How do we bring them into this space equitably? How do we ensure that they feel included? And how do we continue to promote communities of change, right? And I want to segue to Dr. We'll get to end perfectly on time with Dr. Pierce Salguero, who it's a great way for us to segue, because Pierce is using virtual or teaching virtual reality topics in his class. And I think this is a great way for him to add that last cherry on top before we close out. Dr. Salguero, the floor is yours.
Thank you, Kimberly. We close at 4, right? So I'll be very brief.
4:50. We have until 4:15.
Oh, okay. All right. Then maybe I won't be so rushed as I was thinking. But I just wanted to say, as a last minute addition to the panel here, that I have learned so much from listening to the presentations here, and I really want to appreciate, all of the expertise that's been shared here. I was taking furious notes, and I'm very interested in following up on more of the publications and some of the other initiatives that you all have been talking about. I guess I'm coming from a little bit of a different direction, because a lot of the focus here really has been on the hardware and on the infrastructure, and that's not my area of knowledge or expertise. So what I'm really thinking more about is how content creation, the process of content creation, can have the power to create barriers or continue barriers that are already in existence, or potentially break down barriers. And that's where my interests lie. So as I think both Kimberly and also Sarah mentioned earlier on, we all are at Penn State's Abington campus, which is a small liberal arts college right outside of Philadelphia. It's the most racially, ethnically, and linguistically diverse, as well as socioeconomically diverse small college within the Philadelphia area, and also campus within the Penn State University system, which is a public university in the state of Pennsylvania. All of that, what that means is that our student population is unique in a lot of ways. We have a minority of our students who are white, and we have a lot of students who speak a lot of different languages and come from different neighborhoods within the Philadelphia area, where there are pockets of very different cultures. And so we are sort of like a meeting space for a radically diverse segment of the American population. So there's a way that what I'm thinking about and what I want to talk about is also sort of like a little bit different than the global north, global south divides and the developing or developed countries divides that have already been spoken about on the panel. So talking about internal diversity within the United States, within a particular city, and the students, coming from a lot of different contexts together into our classrooms, onto our campus and into our classrooms. And so one of the things that I've been doing, I'm going to share my screen here to show you a project that I've been working on since about 2013, I believe, when we started this, and it's sort of evolved over time. The Jivaca project. So I was introduced at the beginning. I think it wasn't in the recording, so I'll just say briefly. My teaching area is Asian studies, and I particularly focus on Buddhism as my research area. And so the Jivaca project is a website that I created in order to house a number of different student projects related to ethnography of Buddhism. And there's a couple things I just wanted to show really quick so you know what context I'm speaking from. And the first one is this Philadelphia project tab here. If you open that tab, we have a interactive map of about 50 different locations around the Philadelphia area. These locations are all Buddhist temples in Philadelphia. So these are largely Asian American spaces where people speak English as a second language, and where the predominant demographic is Asian. And so we have, each one of these spaces. If you zoom down into any one of these little bubbles, you can click on it and open up a profile of a temple. When the pandemic happened, so I should say these were done by students actually on the ground, going to these temples and doing ethnography themselves. When the pandemic happened, I pivoted with having students putting together ethnographic materials that I had collected myself from around the world. So not sending students into the temples themselves, but rather using photography and other materials that I had collected in order to create sort of a global version of the same project. And we now have, I think, 25 locations around the world where students have put together these profiles of Buddhist institutions. I'm just going to show you one. I picked it at random. This is one in Vietnam that student put together. Summer Win is the student's name. Put together this little blurb about the temple. Put together some photos that I had, and developed some scholarly sources and external links. That's just to show you sort of what the profile looks like. So I guess the reason that I'm thinking about VR at all is because recently I have embarked on the addition of VR immersive tours of these sites. And so I was funded by Penn State to go to Japan as the initial kind of location, and to go around to 12 different temples in Japan and do 360 film and still photography inside of these temples. And so we're going to add to this map that I showed you a moment ago. At the moment, we have nothing in Japan. We're going to add 12 temples in Japan, where the students are going to do all the work they usually do with the write-ups and the photos and all of that. But then they're also creating VR immersive tours of these locations. And so students are doing research into these locations, into their histories, and also into the objects that they see as they look around the temple. Different statues, different kinds of architecture, different kinds of structures that the students have to be able to write captions for and give some historical information about. And so I found it's a really exciting way for students to do the kind of work that I used to have them do, but they had to write like a 20-page paper for, right? Like my old assignments used to be, go do this research and write a paper. And now they're doing the same kinds of research, but it's very much site specific. And it's also giving them the opportunity to put together an electronic portfolio of their work that's out in the public, and that helps them to build their resume. Also, great job skills. These are, skills that I think they're going to come in handy in the future to say that you know how to build a VR environment and you've done so in the past. I think is actually quite a good line on your resume as a young person graduating. But all of that being said, so there's a lot of benefits to this project. I think it's exciting, it's fun, it's innovative, it's different, it's great for their resumes. But it really has raised this whole project all along, and including now in the current iteration with VR, it really has raised significant issue just in terms of the ethics and in terms of the methodology and in terms of the approach and also in terms of the voice of the materials that are being produced, having to do with how are we thinking about the representation of these environments, of these spaces in the public, right? So this is a public-facing website, so students are putting public-facing representations of these sites up online. And, it's led to a lot of really interesting conversations in our classrooms about whose voices are being included, whose voices are not being included. And then as we pivot towards VR, whose perspectives are being included and whose perspectives are not being included in the actual production of the content itself, right? As students choose what to highlight within the space, as students choose how to describe what's going on in the space, they're making choices to represent other cultures in English language and to present them in ways that are going to be consumed by the public. And so this has been a really interesting kind of ongoing point of conversation. One thing that is notable about Abington in particular is because of the student demographic that I mentioned earlier, we actually have a very large percentage of our students who are themselves Asian. I think it's about 25% of the student population. And so, like, as in the example of the Vietnamese temple that I mentioned earlier, Summer Nguyen is a student with Vietnamese background. She's Vietnamese American working on a Vietnamese site. And so we have often been able to pair students, with a site that represents their ethnic identity or their linguistic identity. And when we were working on the project in Philadelphia, we were actually able to, in some cases, send students to do ethnography in the temples of their own communities where they lived and where their grandparents attended, or their parents or they themselves attended the temple. And so that's a really different experience than sending an African-American student or a white student to these same locations, right? And the experience that a Chinese student has in a Chinese-speaking temple environment is completely different than the experience that a Latino person like myself would have in that same space, just in terms of how we're treated by the people at the temple, how we ourselves react within that space, what we have access to or don't have access to, how we are welcomed or not into certain parts of that space. All of that really changes depending on our own linguistic and ethnic and racial, visible and invisible qualities. So I don't have any kind of like neat sort of like, oh, just do it like this, or like, here are the 5 things to keep in mind as you do this, right? There isn't a neat kind of list of, things to think about. just to say that this is an area of ongoing inquiry, ongoing attention, ongoing thinking that I and my students have been doing, and that we're building this kind of understanding of, how to do this kind of work, and what the stakes are for this kind of work as we transition from this sort of web 2.0 version to the web 4.0 version that we are now with virtual reality. And so, yeah, I'm very much interested in having conversations like this with you all, hearing, feedback or questions from you all that would help me to sort of process and think more deeply about these issues that I've raised here. I really appreciate that, and I'm looking forward to continued collaborations and conversations in the future. So yeah, thank you, Kimberly, for the opportunity to join, and I'll leave it there and just see if anybody has any comments for me.
Thanks again, Pierce, and especially thank you for jumping on real last minute, because we weren't sure. There was a lot of craziness going on, but thanks for joining us so last minute. And also
like 2 hours in advance, right?
I mean, he prepared this on the fly.
My pleasure. My pleasure to be here.
But you also inspired the work that our Curious students are working on. Pierce has been kind enough to be working with our students, and he's taught them a lot of what he's already doing, which has influenced even the work that they have produced so far in their We Are Included portfolio campaign that they're doing right now. They're doing the VR version of it, which, again, shameless plug, go to the conference website, find the workshop link, and watch the virtual reality tour that Sarah and her colleagues have put up there. And even better, if you press the goggles on the tour, and even if it's on your phone, it converts it to virtual reality. And even with something as simple as a cardboard, it does give you that immersive type of experience. And if you have the Oculus, even better. But if you don't feel left out. But I'll open it up for the last few minutes before we have to go. If there's anyone online that would like to comment, or if you guys would like to comment also on what Dr. Guillermo has said. Huda, sure, go ahead.
Thank you so much for this interesting project. It's really interesting and exciting. I really like the details that you mentioned about how it's ethnographic, and the details about like who gets to go and do the thing. I feel like it's about reflexivity. Like when you have the you have the insider view, it's not like when you have the external view. Because if you are like Chinese yourself, or you go to that temple, you have that insider view. I know you mentioned also like you don't have like a protocol that you follow, like I have to do this or that, or this is how I do it. But I'm curious about like, how do you select like the temple? Is there like a certain criteria or so? Because I know like there are like some Asian, some Asian locations, but also I saw an African, on the map, an African look and location in Africa and in South America. What was like the story behind that?
Yeah, thanks for that. Yeah, so the site selection process was different in Philadelphia than elsewhere. So in Philadelphia, what we went for was to try to create a comprehensive map. So we tried to include every Buddhist organization in Philadelphia. And the initial contact is always to go to the temple and speak to the person in charge and get their approval and permission and blessing to be included within the project. And if they say no, then we would not include them in the project, but we've never had a no from anybody. So that's for the Philadelphia project. It was comprehensiveness was the goal. When we pivoted to the global project, and that was out of necessity, I couldn't send students out into the field during the pandemic, right? So at that point in time, it was a little bit haphazard. It was about the places that I had personally been to and taken photos of already that I happened to have in my hard drive that I could share with students so that they could do a project. So it was very haphazard, but I had about 20 years worth of ethnographic material that from temples I had visited in Asia over those years, and was able to include them at that point. And then I had them. There was one group of students where, because all of those temples were located in Asia. So there was one batch of students where I was like, okay, we got to fill out the rest of the world. So like we need one temple in Africa and one temple in Latin America and one temple in Europe and one, so had them do a little bit more kind of like internet-based research for those. And now we went to Japan, and that choice was made by a colleague of mine in Japan, a collaborator in Japan, who went around to temples in Japan and spoke with them and got their permission. And that was done more about what would lend itself towards a VR 360 kind of environment. So a lot of different haphazard ways of making this happen, or some more methodical and some more haphazard. And I guess, isn't that how research goes sometimes, right? Or how teaching goes anyway, that you have sort of like sometimes when it's really well thought out, and sometimes it's like you're sort of like making do with the conditions that you've got. And so that's the story about that. But we always have gotten explicit permission to include from whoever's in charge of the temple to include them in the project. That's always been like step number one, no matter how we're identifying them.
Thank you.
Yeah.
Thanks for that question. We are about to wrap up, but I will say, because you influenced our project, the first thing when we went into the application we're using, and we went to user created content, and the dots that are there for user created content are so far and few between, especially as you said, depending on where you're looking for that particular type of content. It's underrepresented in many parts of the world outside of the US. And so that was one of the things that we've been looking at, like, how can we put more blue dots on the map, right? How can we populate the map outside of the US? How can we create more user created content? And using the voice, like you said, Pierce, how can we put our voices behind that? But with that, we do have to wrap up, because I see them trying to come in and out of the room also. Any last comments before we have to go? No? Okay, perfect. Thank you, everyone. I know a few people had to drop off because of time, but I appreciate each and every one of you for taking the time out to lend your voice to this great conversation. Hopefully, this will not be the last of these types of conversations. Hopefully, we've all taken something away from it. And we will continue this in the future in one way or another. But again, I really appreciate each of you lending your voices for today. Thanks again, and you do have a wonderful day. Bye, everybody.
Thank you, Kimberly. Bye.
Thank you for having us. Take care.